Knock, knock. Hello, good morning. I'm going to be your nurse today. Could you please verify your name and date of birth for me?
Estefania is Mario, 08/11/2002.
Awesome. Well, I'm just going to do a quick respiratory assessment, if that's okay with you.
Yeah, that's fine.
Are you having any trouble breathing right now?
Mm-mm.
No? Do you have any allergies?
Seasonal, but nothing too extreme.
Okay. Do you have asthma?
I do have asthma.
Okay. What do you do when you have asthma attacks?
I have a rescue inhaler, and that seems to help.
Rescue inhaler?
Mm-hmm.
Okay. Do you take your do you use your inhaler other times, like before activities or anything?
No.
No, just when you're having an attack.
Yes.
What usually brings up an asthma attack for you?
When I laugh a lot for some reason, or like also whenever it's like allergies also trigger it.
Mm-hmm.
So if it's like really, usually when it's raining outside, I know it's weird. I don't know if it's like the pollen that's like everywhere, but that too.
Okay.
But yes.
All right.
Mm-hmm.
When was the last time you had an asthma attack?
It was a while ago. I would say maybe like 2 weeks ago. It's been a while.
2 weeks ago?
Yeah.
Okay,
Mm-hmm.
okay. All right. Are you having any difficulty sleeping?
No.
No? Okay. Do you have COPD?
I do not.
Okay. Now, I'm going to ask you some questions that may not seem like they relate, that I have to ask.
Yeah.
How many packs of cigarettes do you smoke?
0.
0?
Mm-hmm.
How many glasses of alcohol would you say you consumed in a week?
0.
Do you take any illicit drugs?
Mm-mm.
No. What about any other medications other than your inhaler?
Like over the counter, I take Claritin.
Claritin?
That's really it.
Okay. Do you know if anyone in your family has had lung cancer before?
I do not. No.
Okay. Do you know if anyone in your family has had COPD?
No.
Or any other respiratory disorders?
Nope.
Okay. Now, what would you say your diet consists of?
I eat a lot of protein. I try to eat a lot of protein. This is probably irrelevant, but I'm insulin resistant, so I try to stay away from carbs and sugary things. That doesn't make that, like, I still eat them, but just a little.
Just watch it. Yeah. Okay.
But other than that, I mean, it's pretty, fruits and veggies.
Okay.
Protein.
Yeah. Good. Okay. Now, what is your occupation?
I'm a student.
You're a student? Okay.
That is my occupation.
So you wouldn't really be exposed to any respiratory irritants or anything like paint or dust or anything too bad? Okay. Do you take any NSAIDs? Like Advil or?
Not regularly.
Not regularly? Okay. Any corticosteroids other than your respiratory inhaler?
No.
Are you on any antibiotics right now?
I am not.
Okay. Awesome. Well, my last question for you is: are you vaccinated on all your
Yes.
TB, COVID, flu? What else we got? Pneumococcal pneumonia.
All of the above.
Okay. All right.
All of it.
Okay. And then have you ever had a chest X-ray before?
I have not.
Okay.
No.
All right. Well, I'm just gonna go ahead and get started on my exam now, and I'm gonna place this on your finger. Check your pulse ox. Her pulse ox is 99%, and her pulse rate is 9. I forgot what it was.
It was 85.
85.
Yes.
I would remember. Okay. Now I am going to just look at her and just look at her breathing patterns and the shape of her chest. So she has a symmetric chest. And she's not using any accessory muscles to breathe. Her breathing is unlabored. Her rise and fall of her chest is equal on both sides. Sorry. Now that I've done that, also I would look at her A and P versus transverse diameter. And so that is to look for if you have COPD, your A and P diameter would be equal to your transverse diameter, but for hers is her A and P diameter is less than her transverse, which is normal. Yep. Oh, and her skin is an expected tone. Her fingernails are not cyanotic. Her lips look good. They're not cyanotic. Yeah. And so I'm going to go ahead and palpate her chest. So now I'm just checking for any lumps or masses, but I'm also going to be feeling for any crepitus, which is like crackling under the skin, which would mean that she would have fluid under there. Alright, everything feels all good. No masses or lumps or any crepitus when I palpated. Now I'm going to percuss her lung fields. And so I'm going to do these on both her anterior chest and her posterior chest. So I'm just going to hit it like this. Alright, and when I'm doing that, I'm just listening for resonance in her lung fields. An abnormal result would be dull or hyperresonance. And I'm going to go ahead and do it on the back too. Oh, yeah. Okay, awesome. And I'm also going to do her diaphragmatic excursion and thoracic expansion. So for this,
I can stand if you want.
Okay. For thoracic expansion, I'm just looking at how far her lungs, how much air she can get in her lungs, and the normal result would be 5 to 10 centimeters. Could you stand up? Yes. All right, and I'm gonna have her take all the breath out of her lungs. So breathe in really deep, and breathe out all the air. And I'm just gonna place my hands at the edge of her rib cage, and then I'm gonna have her take in a really deep breath, and my hands are gonna follow with her breath. All right, you can take in a really deep breath. All right, and my hands would stay at the top of her breath, and hers looks about 7 centimeters, and so that would be a normal result. And now I'm going to do her diaphragmatic excursion, and this is just measuring her diaphragm. And so for this, kind of the same thing, I'm going to have her take all the breath out of her lungs as possible, so her diaphragm is resting at this point. So breathe in really deep, and breathe out. And I'm going to start percussing for her diaphragm. All right, and I'm going to mark with my fingers where I felt her dullness when I percussed. All right, and then I'm going to have her take in another really deep breath and hold it at the top. Okay, and so you can let out. Okay, her diaphragmatic excursion was 4 centimeters, which is normal as well. You can go ahead and take a seat. Okay, and now I'm going to auscultate. Oh, I didn't do one thing. Before I do that, I'm going to go back and do my tactile fremitus. And that's just, it would be in the palpate portion of the exam. But I'm just gonna feel in her lung fields when she says 99, and just hear if they're equal in all lung fields. All right, say 99.
99. 99. 99. 99. 99. 99. 99. 99.
Awesome. And with that, you would expect it for the sound or the vibrations on my hands to get less as I go farther down into her lung fields, which was normal and the expected result. So I'm going to go back and do my auscultations of her breath sounds. And I'm just going to listen in all lung fields that they're clear and equal, and I don't hear any rhonchi or wheezes or stridor or anything like that. Taking a deep breath. 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 And now I'm just going to listen to the same fields on her posterior chest. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Awesome. All of her lung fields were clear and equal. Yep, there were no extra sounds present when I listened. And then I'm also gonna have her say 99 again, and I'm gonna listen on all those lung fields and hear for any abnormalities with that. So when I put my stethoscope on your chest, you're just gonna say 99 for me.
99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Awesome. And with that, I would also expect for the sounds to get muffled as I move along. Her lung fields also muffled when I listen up here as well, which is normal. All right. All right, and that completes my respiratory assessment.